People need help. Item 2, apologies for absence and any substitutes.
Thank you, Vice Chair and Chair. Apologies from Councillor Carol Jackson. Her substitute is Councillor Tony Winklis. Councillor Ken Rolls, substitute is Councillor Roger Truelove. Councillor Richard Palmer, substitute is Councillor Sarah Stephen, and Councillor Pete Neal. Thank you.
No sub. Okay, then, item. Any declarations of interest? No. Item 4, minutes of the last meeting. Is it okay to sign these as a correct record?
Agreed.
Oops. 5, presentation from Medway NHS Foundation Trust, New Community Diagnostic Centre rollout. Had a report. Welcome, Nikki Teasdale. She's going to take us through this. So over to you, Nick.
Thank you very much, and thank you for having me tonight. I'm really quite excited to be here. This is a really exciting project, and we're very lucky and fortunate actually to get the funding, because the day after we applied for funding, the rest of the money for all the other CDCs or community diagnostic centres was pulled. So we literally got in by the skin of our teeth. In 2020, following the first sort of wave of COVID, there was a review done in relation to diagnostics, and we know that diagnostics are not where we want them to be. And the COVID pandemic, whilst we were from an acute to hospital acute perspective, whilst we were performing okay before the pandemic, the pandemic, as you know, has caused huge backlogs in all departments across the whole country. We needed to build a diagnostic centre. We used the planning public health departments across both KCC and Medway Public Health to do our strategic needs analysis. And we wanted to put our diagnostic centres, we wanted to focus them around health inequalities and around areas of need. We had a lot of pushback, as you can expect, because there was a lot of areas that would qualify. The 2 areas that came out as being the greatest area of need for diagnostic centres were Sheppey and Medway Central. We haven't got a site in Medway Central that was suitable to convert or to make into a diagnostic hub. And the consensus, based on the health inequalities and the demand and capacity modelling, was to put the hub in Sheppey, with a spoke being in Rochester Healthy Living Centre. Now, the hub and the spoke, regardless, are open to all because they're NHS, so all patients across the whole of Kent and Medway will be allowed to access them, at the same as all patients can access any other health facility across the Medway, the Kent and Medway patch. But obviously, primarily they're there for the residents and the population within those patches. The hub will be will have all diagnostics in, so it will have everything from MRI scanning, CT scanning, DEXA scanning, which scans for frailty and dementia pathways. It'll have ultrasounds. It'll have low-level diagnostics such as ECGs and spirometry. So everything that you would expect to find in an acute facility, as in Medway Foundation Trust, will be available within the Sheppey Centre. We've started what we call our feasibility studies, and we've got the architects on site at the moment. There is a desperate need at the moment to have urgent MRI, because there's a significant backlog at our acute trust with MRI at the moment. And the national team agreed for us to place a mobile MRI unit at the Sheppey Hospital site in the interim while we do the build, which means that from early spring next year we'll have increased MRI capacity at the Sheppey Hospital. We didn't get approval for additional MRI at Rochester, We got it at Sheppey based on the health inequalities that the residents of Sheppey are facing. The other thing to add in our design, we were very keen to target some of the higher level health inequalities, particularly that we see as a result of late presentation from people that are living within the Sheppey vicinity. The key one being lung cancer. So a lot of our patients in Sheppey present very, very late with lung cancer diagnosis. So they tend to present in stage 3 or 4, which has generally very poor health outcomes. What we've agreed with the Cancer Alliance is that while we're building this community diagnostic centre, we're going to start a pilot for targeted lung health checks. And that pilot will start from hopefully, depending on when we can get the equipment in place, but hopefully from April next year. And that will be actively targeting people without symptoms, but that have got a history of smoking and are over a certain age, to offer them CT scans so that we can hopefully therefore pick up lung cancers in stage 1 and 2, which, you know, obviously give huge difference to outcomes for those patients. We're starting in Sheppey because that's where our greatest health inequality in relation to lung cancer is. We'll be then moving that service over to the Sittingbourne area and also across to Medway. So that's something that we'll be incorporating into the community diagnostic centre as it progresses. We're expecting construction to start in April next year, and that obviously a lot of things have got to land in place for construction to start. We're using void space of Sheppey Hospital, so we're reconfiguring the space that's already there rather than new build, which obviously brings the price down and is partly why we got the permission from the national team and the funding to do it. We're hoping to be up and running with some of the services by the end of the summer next year, and then fully functioning by the beginning of, or should be by the end of 2023, beginning of 2024, we should be fully functioning. The Community Diagnostic Centre will be a 7-day-a-week centre. It will be open 8 till 8, so it'll offer huge access to the patients and people needing the access. And we will be working with local services, including sort of GPs and pharmacists, to look at how we can then modify different pathways. So the plan eventually by 2025 is to have one-stop clinics out there. So, for example, it might be that, you know, we have a respiratory clinic and we have a one-stop shop. So someone comes in, has all the respiratory tests they need, and then see the consultant in order to try and minimise the need for travel. So I'm going to pause there because I think everything else is in the paper, and obviously very happy to take any questions.
Just a minute. Some years ago did a social value policy, and one of the questions is, do you have anything like that in the NHS? Like added value that we might get out of the contract. I'm thinking of apprenticeships, stuff like that. That was really just about the contract. Before I let you answer and take Bill, fantastic news, absolutely fantastic.
Yeah. Thank you. Absolutely fantastic. Now, what about the consultants? What about where we've got now, where GPs are only too quickly to refer you to Medway, A&E to try and get an MRI?
So yeah, there will be direct access for GPs. So for certain pathways,
our GPs
yeah,
are not doing it. They're just passing it on. They really are. When we had DMC up there, rather than this walking that we've got now, DMC, you need an X-ray, here's an X-ray form, go and get an X-ray, here's a blood test, go and get a blood test. Right, great. I mean, I've had a couple of MRIs. Oh, you need an MRI. Now I'm waiting a week. Then I'm waiting a week for results. You know, time is precious. delay.
More, which is why we're building a community diagnostic centre within Sheppey itself. There will be reporting on site. The radiologists are radiology consultants, so they'll be able to read the scans on site, and there will be direct access for certain pathways, not all pathways. If we gave GPs open access to all pathways, we'd flood the service, and it's not always necessary. So there will be pathways that are agreed clinically where the GPs can refer directly into the community diagnostic centre. Equally, MFT can use it as an additional resource, obviously within the local community. So we should see delays reduced.
Definitely going to get some consultants.
We're definitely, well, as long as they come to us, but yes, well, we're very optimistic that we're going to get some consultants. So from an added value, we're working very across the whole of the voluntary sector at the moment. We're looking at apprenticeship schemes. We're looking how we can do different volunteering. I met with Sheppey Academy last week to talk about how we can give the youths opportunities, and we can give different careers, ventures, and hopefully excite them that there are different opportunities within the NHS other than being a doctor or a nurse.
Mike?
Thanks, Chairman, and thanks, Nikki, for that. It is very good. Appointment tomorrow to see a consultant for the scan I had 3 months ago. I'm still another scan I've had. So this is really good news if you can speed that. Within the paper, you talk about the workforce staff. So just elaborate and expand on.
Thank you, and you're right. I mean, workforce is our biggest challenge and it's our biggest risk in relation to recruitment. Because we've got quite a bit of lead-in time with delivery for this, we've got time to actually go out to recruitment, and we had some very strong success recently with the international recruitment at the Acute Trust in relation to radiologists and consultant radiologists. We also, when we recruited, because we, in the back of our heads, were very hopeful that we would get the diagnostic centre funding, we did pull some more consultants in from the overseas recruitment that we've got on bank. And so whilst they haven't got substantive positions at the moment, we sort of encourage them to come over on our bank. So we are confident that we will recruit. We're also starting now apprenticeship schemes in relation to some of the lower level staff and some of the sonographers and people, so that we could actually start to train our own. The short-term solutions, so the mobile MRI scanner, they come with staffing. So we're bringing them in early, so that again, that gives us a bit of lead-in time, you know, so that we can sort recruitment. Government obviously have given this initiative and said that, you know, build community diagnostic centres. It takes 3 years to grow a radiographer. So we're not going to grow these on trees overnight, but we are confident that the recruitment schemes and the reallocation of staff, because you don't always need to see a consultant, they're not always the best person to see. And actually it's about making sure the pathways are right and making sure that people are seeing and accessing the right person at the right time.
Thanks,
Okay.
To read it out. Late stage dementia, broke hip and thigh, laid on a cold floor, confused, stressed for 5 hours, waiting for an ambulance, which I understand is a general problem. To William Harvey, A&E, 10 hours. Transferred to the QE in Genmarga on a trolley. You know, is there any answer to that?
that's not anything that any of us that work in healthcare would want to hear. I'm a nurse by background, and stories like that are awful, and it's not something that I would be condoning. Unfortunately, I can't answer that particular case or concern. It's not within my jurisdiction. Unfortunately, I can certainly take you know, link up afterwards and take a conversation back to the people that do look after the William Harvey and that area, but that's not within my area, I'm afraid. But they're not stories that we want to hear, but we're hearing them all too frequently.
I'll let you finish, Tony, because obviously Carol would have jumped in if she'd have been here. We're not really here to all give you examples of cases. We're here to celebrate good news, but to ask questions about how it's all going to work. Nikki's very kindly offered to talk to you afterwards. I've got Sarah and then Ken.
Job.
No, that does not matter.
But basically, I was stretch. We were in the 80s and 90s. Running and setting up one of the first early pregnancy. Are you in this one-stop shops? Moved off quite early. But it's such an important thing, and gynecology in particular is just a nightmare.
And in the, yeah, and I absolutely get that and appreciate it. In the first wave, no, but that doesn't mean that it won't be included in the pathway design as we go forward. A lot of the pathway design in the early stages is dictated by the government, so we haven't got a choice in some of the pathways that we do as early adopters. So a lot of we're getting the funding to support recovery. So they're giving us the funding so that we clear some of the backlogs and clear recovery. And a lot of that recovery is around respiratory and cardiology, and dementia diagnosis and early diagnosis of cancer. So they are absolutely the first key elements that we need to target. After that, it's down to us as a health and care partnership, and the health and care partnership is you, it's all of us, everyone signs up for that. So Swell Borough are a member, and they're an equal, voice around the health and care partnership table, as along with everyone else. So once we move out of the dictated part that we have to do, the rest of the pathways we can design around what our needs are as a health and care partnership. And so that's where it becomes really exciting, and we can start to do something that's really meaningful, long term, and that's sustainable for the future of the island.
Yeah, because I see not only the island, but I see huge development going on, lots of young families moving. In terms just it's something that I know that other things are in, but this is the young people, and it's crazy because it is a one-stop shop. I used to literally do the whole thing. I was admit everything, so you didn't need it.
It is, as I say, it's pathways that we be putting sleep studies in Sheppey if we didn't have to, because we haven't got that we have to. So there's an element of the national criteria that we have to do in order to keep the funding.
Hopefully that'll be the future.
It's on my list.
And I'll be a champion for it if you need anyone to connect.
Thank you.
Chair, sorry, can I, some of the remote members have said they're having difficulty hearing members that are on the sort of back row, and they can only hear on this table in the front row, so I don't know.
Okay, if you want to speak and you're not on. Okay, but she's talking herself in.
Oh, contract. It's
Yeah.
Get the contract, get a sign that.
Ken's on the front row, so speak loud. Really thinking here.
Loud. Thank you very much. No, it's wonderful news. The Minster Hospital quite well. It has an X-ray department. The diagnostic and the MRI scanning in the actual hospital itself. You still. I used it the other day. I couldn't get hold of my doctor. I just walked in there. So whereabouts physically?
So I know some of that, but I don't know all of it, unfortunately. We've got the architects over there doing the planning at the moment because there's quite a lot of, if you've been over there recently, there's quite a lot of work going on over on there at the moment. We're also developing a frailty unit over there, and we need to move some. So some services are being moved. I understand there's an atrium. I haven't been to the building for many years, but we're moving some of the services across so that it creates room for the MRI, the X-ray department. So there's 2 rooms within X-ray that are not currently used. So they're being repurposed. The other X-ray room is being refurbished so that it can take more capacity. And obviously that will be open longer because at the moment it's only 9 to 5, Monday to Friday. The CT scanner will be a mobile scanner, because we're going to be using that for the targeted line health checks. So we need that to be mobile so that we can not just facilitate at the hospital, because we need to access more of the population. And we'll also be taking that unit into the prisons, because the population within the prisons, it's much easier to take a unit to them than it is to bring the prisoners over to the unit. So we need the CT scanner to be a mobile unit, and that will obviously sit outside. No, the redundant ward is being developed into a frailty unit.
That's right.
And I've got Alistair next.
Will there be endoscopy?
No, it is very important. It's a very important part, and we did want it in the plan originally, but the endoscopy capacity wasn't included in the funding in the CDC or community diagnostic funding from the government that came down. So that won't be included, but we have put in a bid for increased capacity at the MFT site, which we're very hopeful will get secured.
Thank you, sir.
At the moment, they've given us the capital to do the build, and we've secured revenue for 2 years of staffing. We haven't, from a national perspective, they haven't guaranteed any further revenue funding for that. National team have given indication that funding will continue, but it hasn't been guaranteed. So we're taking that on at risk.
Roger.
So I think Mike said this is really good news. I don't think we've had any better news. So real congratulations to everybody involved, which seems to be a lot of people. So we've got the Medway and Swale Community Centre group, and it consists of lots of parts of the health service and also local government. Just for the sake of us as members, in actually putting together this bid.
So Swale Borough Representative Charlotte and her team have been round the table, and members of Charlotte's team have been at all the planning meetings and making sure that the Swale voice has been there. The work itself has been done obviously by a very small team, because you couldn't have the multitude of organisations that we've had involved, it would be a little chaotic.
I'm just wondering in terms of social deprivation, whether we actually inputted quite a lot of it.
We've been working with obviously the BBI team, which I know
Yeah.
have been present in Swale Borough, and we also used a lot of the resource from Medway Public Health Team, who have got the data for Swale. So the Medway Public Health Team are equally a part of our health and care partnership, and so it was actually the Medway the Medway Public Health Team that said that the health inequality was greater in Sheppey than it was in Medway.
Which is established right across
Yeah.
North Kent. The fact that our area, that particular area, has got great deprivation.
So
Okay, well,
For information, the Kent, when it was a joint, Kent and Medway Health and Wellbeing Board, NHS were obviously partners on it. But instead of trying to spread the NHS jam so thinly for areas aren't even raising up at all, what we agreed was that the NHS should target places of health inequality and social deprivation, which some of the people from the NHS uncomfortable. Everyone, but that was those areas were just getting worse and worse and worse. And Sheppey, obviously, Sheppey was one. And I'm very pleased that they have looked at the figures. Another, this is great, and I've sort of got a picture. Some years ago, I was working with Jerry Adler on like a one-stop shoppy type, as well as not that. Instead of having to go to all these different places.
yeah, so you talk about the urgent treatment centre, and yes, that's still in development. Obviously, COVID put that very much on the back burner, as it did with the national. But I'm not closely linked to the urgent treatment centre, but I know the plans are still in development, and that still is the plan to have that there.
Because that would. Bill.
It's just a suggestion for you. I've spoken to several GPs on the island, and if they had their way, they wouldn't even come over on it. Right? They all live off the island. Make accommodation available to medical professionals that would be prepared to reside on the island, close to their places of work. That would be great. I mean, the old days, there used to be lovely nurses' homes.
Yes, I wish I had a pot of money. I really do, but obviously the money to the NHS has been cut along with everything else this year, and we had to fight quite hard to get the money for the diagnostic centre, and we're currently putting all finances into recovery and trying to get recovery as quickly as possible.
Money for staffing.
For this project, yeah.
I mean,
Not
if
for
you don't get any
accommodation.
staff, you've saved yourself 2 years. Staffing has got to live somewhere.
But then I don't open my diagnostic centre, which
Fair enough.
I really need to do, because the population on Sheppey, I've spent a lot of time with Charlotte and Emma over the last 18 months. I'm a clinician by background. I've very much over the last 18 months put a community lens on. I've been working very closely with the community and the voluntary sector over here. And I've been doing a lot of grassroots stuff, you know, working with Paul Murray in relation to the bus, and lots of other things, working with the academy, looking at what we can do to help the children actually aspire to something more than they've got. And the health inequalities in Sheppey have shocked me, and I thought I was unshockable.
Where do you live?
Not in Sheppey. But they have shocked me, and it's time that we stood up and took notice, and that's why we've proposed that the CDC or the diagnostic centre comes there.
Agree with you 100%.
But we'll get the staff.
Okay. Elliot, go on, mate.
Especially welcome the increase in X-ray. Will there be an increase in parking? Because parking is in high demand on the site as it is.
We've had these conversations. I understand, I've been talking to NHS Property Services. I understand there's some void land that's owned by NHS Property Services that we'll be looking at configuring into parking spaces, because we will be obviously putting the CT scanner in the car park. So therefore we need to repurpose some of the void land. So that will be done as part of the build.
Thank you very much, Nikki. We can finish that because he might.
Love the 1849. Long may it live.
Ben Martin, do you want to?
But said here quite clearly, everyone's very happy and content with what's coming forward, and obviously very hopeful for staff in front. We never cast iron guarantee staffing anywhere. So thank you very much for actually agreeing to come and run the gauntlet of this actually quite pleasant one. And giving us the update, and obviously very welcome news for particularly in Sheppey and hopefully in the wider Swale area.
Just ask how often you'd like an update in relation to either a
When
briefing report
When
or.
there's something to report. Well, we're still working on this, when you get to your next, what they call them, milestones. Yeah, we can't wait.
No.
Oh, we really
So we've got down all the agenda.
Wonderful stuff. Everybody, and my apologies for the tardiness. He's not been stuck in the A849 at some point over the last year. I'm sure that junction upgrade will be finished soon. Where are we? We are item 6, which is our housing, homelessness and rough sleeping policy. And I will invite Charlotte as the officer to introduce the paper.
Thank you, Chair. So this item really is setting out a revised housing and homelessness and rough sleeping strategy, as the current adopted strategy expires financial year. So there is a draft proposal on the table which sets out and has looked to analyse our housing data, our housing need, and the demand on the services that the council has statutory obligation to provide. It does build on the previous strategy, and as you can tell, in terms of the priorities, they are aligning to what is currently there, but it is a statutory requirement for us to have a housing strategy under the Homelessness Act. Requirements of this and develop it going forward. So the draft strategy, which I won't go into any detail, but happy to take questions on, consultation. Like any strategy that is put together, I think contribution from obviously members of the committee, but our wider public, partner agencies, and particularly the customers that use our housing services is really important. So this is that first draft for consultation, and I would think that's all I've got to say in summary. Happy to take any questions and sort of put the obviously the detail of the recommendations is really asking the committee to approve. Week period.
Wonderful question. Charlotte, you know that.
I'm going to start by asking Bill if you would like to ask the question.
Sorry, Chairman, I've been in conversation with Charlotte about the subject matter. I feel going now, right now. Well, it's come December, January, February, it is really going to make a difference to a lot of the figures. If what should happen doesn't.
I'm going to take a wild guess that this has something to do with caravan parks.
Holiday sites, caravan parks, whatever you want to call it. If you live in a static caravan, like you pay land rent to the landowner. If you live in a bungalow, there's every possibility you pay council tax, but there's also a possibility you don't pay council tax. The occupancy of these parks, with the exception of 6, are maximum 10 months, but minimum 8 months. Some months are already shut down for the season, 10 months go on, which means that they should be vacating their properties by December and January, going back to their primary address of what they signed up to. But they don't, they just become overstayers. Their fingers at enforcement, right? And since the last COVID thing, when the gentleman said, oh, you can all stay down there again, he has now made the managers of the site and the site owners responsible for the overstaying residents. To me, that gives us a full opportunity that if it's sent out to the site owners, managers. Residents that live on the island, i.e. GPs, schools, etc., 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 go home for 2 months and we'll see you in March. And it makes a difference to the figures and graphs, by the way.
So in terms of obviously that we're looking at, there is absolutely a hidden homelessness issue that is the caravan parks demonstrate. It does cross over with obviously the planning regulations and legislation. So, but what I will do as part of this consultation, and I'd say we've spoken offline outside of the committee around that, is look at linking in the caravan parks and the hidden homelessness. Absolutely, I think we've already parks that are likely to close from the 1st of January. Residents within those know that they don't have an alternative location. We are obviously working with them in a prevention capacity. So some of those figures are picked up within the statistics within the strategy, because they present themselves as prevention cases and potentially as a relief case if we are deemed to have a responsibility for them. Some people solve their homeless issue themselves in the summer period where it's suitable to, they can access a caravan park, and these things go on for a long period. And as you mentioned, during the COVID period, there was a national relaxation of some of those requirements, because obviously some people do reside abroad and do make alternative arrangements for that period. So I think absolutely we'll make sure that caravan parks and relationship with homelessness is picked up within this strategy. Some of those figures are there, but they're probably hidden in the general figures. that it's drawn out as an issue.
Sorry, Charlotte, I don't want to have a property like having to do with holiday sites, holiday makers.
But people use them
If,
as their temporary housing and
But they
therefore
also
it can
sign a
become-
piece of paper
ladies and
saying
gents, if
they're
we can go
the
through the
property
chair
owners.
rather than just having a debate on the side, the rest of the committee might want to ask some questions. But I do understand where you're coming from, councillor Tatton. And don't get me wrong, holiday parks, yes, should be being used for holidays. The fact is they're not, because there is insufficient accommodation in this borough for the people that wish to reside in this borough.
With due respect,
And as such, people are taking the option because they weren't able to get other accommodation and have to stay in holiday parks. They shouldn't be. They should have their own permanent address. But many of them do
their
not.
primary address.
Their primary address. And unfortunately, that's not the case. And also, in terms of people overstaying, those caravans are not suitable accommodation. From a licensing point of view, we wouldn't want people staying in some of them
But
over
we
the winter
allow
months.
them
In many respects, it's a planning issue. And that's, so I saw councillor Whiting next.
Thanks, Chairman. Just picking up, it is a planning issue. They've all got planning conditions on them that don't. They all ignore it. They allow the people to stay there, and our planning enforcement. It would be very difficult to go enforce those standards on people. Like giving those their primaries, they've got children. Got to that stage where we are with it, aren't we? We talk about first homes. I just got a concern because the policy is being drafted as part of the local plan. Well, we know that the local plan is now on indefinite hold. So is that being drafted as part of something of this committee's remit? That's it's about the no use empty officer. I've always been a great, so I just wonder what it is that why we're not managing to find the right candidate on that. Thank you, Chairman.
Yep, so I can, if we take the first homes element first, so is a, you know, precedent set by the government around the minimum standards of whether it's kind of like a standalone policy in terms of the local, the first homes policy, which will sit within the suite of the local plan. So the local plans team are leading on that, and will obviously come forward and be adopted, but not by this committee, by the, what it's called now, whatever the local plan committee is now called.
P&R eventually.
Yeah.
But the Chairman, through you, it would be useful, I think, if we had sight of that draft with the P&R.
Yeah, in terms of that, it is a very new initiative. There are, I think it's one of those things that it will emerge to see how effective it is and things like that. So we just need those parameters around the discount rates really and things like that. And we can set some local criteria. So it is about that element. But obviously is quite positive for low cost home ownership, but will possibly impact on the amount of social rent and affordable rent properties through Section 106 agreement. So it gives on one hand, but it also takes on the other hand. But once the policy is drafted, that would probably be an interesting debate in itself. In terms of the no use empty post, this has been out on a couple of recruitment drives. We've also looked at changing it and regrading it and various other things to try and understand why it isn't being recruited to. I think that sector in particular, particularly in the private sector and the technical officers and environmental health officers, seems to be a very tricky area to recruit into at the moment. And we had a senior environmental health officer, which we have recruited into. And again, we've been very lucky who we've got, but that I think was more, you know, that wasn't a huge pool of people that have applied to it. And it's a similar.
Yeah, I wonder, Chairman, if I may just leave you to come back. So, you know, we can make a start and early on Stephen's case.
Ability, of course. Private sector wages are no doubt slightly.
So some work has been done with the work, but it's been more of a paper-based exercise and obviously encouraging people to do it and referring to no use empty scheme. But as with anything, if you've got an officer that to drive the then more focused work can be done. So I think that's just been fortunate, particularly because there was an increase in last year's budget to make that full time, to also make that post more attractive because it was a part-time role previously.
Just if I can close, Jeremy,
Oh,
because the reason I'm so in favour of the scheme is because you can put conditions.
Questions? Councillor Harrison.
And 2 points. First of all, I mean, I've read this 3 times. Yeah. What came across different threads. But, I mean, one of that page that says financial implications, this, that, and the other implications, health and well-being implications. For our staff, because these are extremely stressful jobs, and certainly during the pandemic, while we're all out there doing it and seeing people face to face. I know they took precautions, but even so, I would suggest that there's probably a very early burnout on this. So I'm very concerned about health and wellbeing of staff and what sorts to actually on them and make sure that that's the point. And the second point is, you have this every so many years you have the I don't get involved in that many now, or where they don't need to give you a reason, they just kick you out. So do we have any idea of the backlog of private sector housing which unhealthy? Is there any more that we do to be in terms of letting private sector tenants know that and somebody else is going to come in and take over that unhealthy property? The government brought in the decent home standard. There's never been anything brought in for a decent home standard.
Before I hand to Charlotte to start answering them, there was consultation about 3 months ago, government consultation on an introduction of new standards for the private sector. However, it was tied up in a consultation on restricting the increase in rental prices for social rent properties, and therefore reducing the amount of money that housing associations would have to spend next year on more properties. So yeah, all tied up in one hit. And I do agree in terms of the pandemic and the staff, in particular the burnout. I recall full well being told you can't come out and support us in dealing with the rough sleepers anymore because we can't insure you during the pandemic as a councillor, but we're still insured to be out there. and just thinking, what the heck do you do to help and support them in that? So I think we do owe a huge debt of gratitude to all our staff for the last few years and how much they have achieved in that time. But I'll hand to Charlotte on that.
Yeah, so in terms of the health and wellbeing of staff, and I'm very proud to have a fantastic service and a teams that deliver really, really the sort of chair just said, particularly through the pandemic, the Everyone In initiative, the amount of work that had to be done to turn around and house the rough sleepers at sort of record speed really, and the ongoing management issues of doing such a scheme, I don't think underestimated. It's significant. I think are dealing with much more complex cases, particularly talking about housing options team than we have ever seen before. People are struggling with health issues. We have people who have been trafficked. We have people that are fleeing gang violence, are subject to cuckooing, domestic abuse. So the makeup of our client group has changed immensely over the last few years, and it's a lot more prominent in terms of the types of issues. So it no longer is just an assessment of your housing needs, it's very much an assessment of your social needs as well. And the staff, quite rightly, aren't social workers and haven't gone through the training and the mechanisms that work. That said, we are very conscious of that, and the levels of supervision and the sort of team leaders, and obviously Roxanne Shepherd as the overall manager of that team, provide an awful lot of support. We have been really fortunate with our Rough Sleeper initiative funding, and the report does document the successful bids that we've had there. That one of the services that we have within that is a psychological support service that is for our Rough Sleeper clients, but is also available for our staff in terms of case problem solving, but also in terms of case supervision for them as well. So on some of those particular cases, and obviously which is part of a role and kind of is typical within a service. It's very difficult for staff to deal with, and as an employer we have support that we put in place. It's really important that we absolutely, in terms of those difficult issues. So the other issue around condition survey, we obviously there are condition surveys that do happen. It has been quite a while since we've done a full stock condition survey, so that is very difficult, because obviously it is an assessment. We do have some access to some data which EPC data ratings, and therefore some of the conditions can be picked up from there. Work around energy works on there, but it's very, very difficult for forward if they think they're at risk of losing their property. So it's a very fun, quite a lot of mediation, even though it's an enforcement team. A lot of it is preemptive mediation in terms of trying to resolve issues. Want to take enforcement action if we can resolve it at an earlier stage. So we do tend to work on it is responding to complaints that come forward.
Question, if you like, Mr. Chairman. Over the last few years, councillors ask me questions I wonder, I know, you know, that in a nutshell, there is a system for housing. It's points based. You have to bid. It's the same system, whether you're bidding in Swale or Maidstone or and I wondered whether we should have a could be part of a programme after the May, every time you get a new cohort of councillors in, to actually sit them down and say, right, the staff that we've got work without fear or favour. So that it isn't all, yeah. No, that's not the way it works. The house any quicker are based on I'm not saying I could do it, but I mean, I could probably look through the sheet and say, well, you've got the top points of that, and they've took all the. So members saying, oh, Mrs. I shouldn't say Tin, wants her points checked, because she doesn't think she's got enough. She doesn't think you've taken into account X, Y, Z. In actual fact, you have. So I think, but it's, the councillors tend to insist, and in staff's time. Training session, so that all members can understand the system. So that when Mrs. Martin comes to you and says, I don't think, I think I should get more points. Know exactly what the system is.
Understand entirely where you come from. I think over the last few years, I tried very hard not to bombard with appeals to Zoe's desk. And I think I did an all right job of filtering out the ones where there wasn't any real reason. I think the one right off the bat is go to the Kent Home Choice website and watch the video. The one thing on that YouTube video that's inaccurate is the number of properties that you can bid on, because there's no longer a limit. You can bid on as many as you like at the same time. But everything else in there is simple, down to the point. This is how you bid for a property. This is how it is assessed. This is what happens next. It's great, and it's all done in 4 minutes. And it works for okay, it's designed for the potential tenants, but it works for everyone. It's certainly something I think would be beneficial and would probably reduce the amount of time that it is probably that ends up having to do the appeals.
It is, yeah. So obviously the housing allocations policy is a policy that any revisions will be agreed by this committee, which obviously sets out there is a range of that policy that is kind of nationally set, but there obviously is local that we are looking to bring forward revised housing allocations policy, which is on the board. Align with any revised policy, which would probably be in those timescales. We've been doing quite a lot of housing option surveys and looking at how we can make that. And some of the advice that we've had is the housing allocations policy is one of our most effective tools to help people most in need, and also how we can help to prevent homelessness. So that will form part of the next review of the housing allocations policy and how we utilise the social housing that we get, even though has been growing enormously over the last few years, is still showing a deficit of what actually we require. So the allocation to it really does need to be as effective as possible. And unfortunately, every applicant on the housing register thinks that they're and quite rightly, because if you're not going to advocate for yourself, who are you going to advocate for? So we do understand that. You know, the policy is there to make that fair and transparent and go from there. We can arrange the training.
I've got Councillor Gould, and then I'll return to those that have spoken. Do you want to come forward just so that the glorious owl can pick you up?
My question, I meant that it may not be for this discussion, but while we're on the topic of housing allocations, one that lands across my other desk is about property. Will there be way in which you take into account medical needs and relevant for housing needs?
Extremely welcomed. I think. Different pieces of spectrum around. Got additional bedroom needs because you've got caring responsibilities and things like that. But, so we can absolutely, in terms of the review, even before we bring forward that policy, I think that is a very productive with local GPs, and we can do that. Be a great advancement on the current.
Before I go back to Councillor White, I'm just going to double check if anybody else has got anything. I'll make this the final one before.
I'm going to make a quick one, and Charlotte Chairman has answered it. Is the review comes to the committee, it says here on the 7th of March. So we will get the opportunity in March to go through that.
Yes, it will need to be consulted.
And that would be perfectly timed then for the training sessions that Councillor Harrison talked about with the new intake.
That is part of it, so I just need to work out the timescales of looking at that medical element as well, but we will look to bring that policy forward.
And propose from the chair on this one to approve the draft strategy and take out the 12-week consultation. If I can have a seconder, please, Councillor Harrison. All those in favour? That's unanimous. Happy days. 7, which is the forward decisions plan. Let's forget how big the take anything from the floor. We do need to put in the final strategy approval of the final housing homelessness and rough sleeper strategy 23-27 onto March's meeting because it does need to be on the plan. So please take that as added in. Any questions on the forward plan going forward? Happy to accept that one and note it. Wonderful stuff. Oh, there's a Councillor Harrison. Well,
BBC. Don't have any further dates yet. Was it? Yeah.
So it's my mistake on here. The temporary accommodation options was TBC, but that is scheduled for January. The housing assistance links in with obviously the Saving Facilities grant review. We are looking at what needs to be reviewed. I'm doing the whole team on our grants process. work in, but the policy work will come towards the end. Let procurement award was a piece of work that we were working with Maidstone and Tunbridge Wells on around procuring our current temporary. By the Kent piece, I think quite sensitive at the moment, so I think it's about timing around. At the moment, but what we didn't want to do was drop off that would be a forthcoming decision.
That's called having a good idea and everyone jumping on it, just as we were getting ready to start tendering. If we're all noted and all done there, I think we can call the meeting to a nice healthy close at 8. So, thanks very much all for your attendance. Safe journeys.
Well done, boss, you made it so